decades, more and more women have opted to get mammograms, which, despite some discomfort and anxiety, provide the best way to detect breast cancer early. Joining us now to tell us more about the importance of getting checked is Dr. Jamie Gilsbrandt, fellowship-trained breast imaging radiologist with Lovelace Women's Hospital. Doctor, so you and I were talking about this a moment before. The American Cancer Society last week, I believe, released a statement saying less is more on the checks. No.
Unfortunately, no. The magic number is 40. Every year, age 40. And why? It's all about saving lives. You can't argue with the scientific data that shows the best way to catch breast cancer early, when it's a smaller size, before it's felt, earlier stage, and when it's curable, to prevent unnecessary deaths, is by getting your screening mammogram every year starting at age 40.
Okay. And so, you know, I mean, obviously you hear it all the time when people are talking about the survival rate. We're seeing the survival rate hopefully going up with breast cancer, and it really depends on catching it in stage 1 or catching it in as early a stage as possible. So, now, the routine mammogram starting at 40, my first thought I think honestly at the start of the month, was that women start at 30. But 40, why is 40 the magic number?
That's when the benefits really pick up. That's when your risk of getting breast cancer as a woman picks up. And so that's when routine screening can really catch those women that we can catch in early. And again, it's all about saving lives, preventing unnecessary death from breast cancer.
Right. So for women maybe in their 20s, they have not gone through a mammogram before, you know, being delicate to the situation, could you walk us through exactly what happens during a mammogram?
So when you show up for your mammogram, you'll be given a gown to put on. And then a specially trained technologist will take you, position your breast in the machine, apply light compression, and then low-dose x-rays are used to create an image of the breast. Then a radiologist such as myself reviews those images and compares them to any images that you've had done prior and looks for certain changes in the breast that could represent early breast cancer. And so some tips and tricks on mammograms. Number 1, it's important not to wear any deodorant or any oils or lotions on the breast the day of your mammogram. If you're concerned about the discomfort with the compression, schedule your mammogram for the week after your period, where your breasts are least sensitive. And the third most important thing is bring any prior mammograms with you. Not just the reports, the images themselves, because that allows me to compare back to prior years, and it means that you would have at least likely to have a false positive when we have things to compare back to. So very important.
Okay, so make sure that history, that you were taking that history with you. Now, if someone wants to get more information on this, they want to schedule their mammogram, talk to a radiologist, get a little bit more information, what's the best way to do that?
So talk to your healthcare provider. We're not, as radiologists, we're not telling you not to get mammograms every year. Talk to your healthcare provider. Go over your risk, your family history. There's some great information on endtheconfusion.org that the Society of Breast Imaging put out. And again, Lovelace Women's Hospital, we offer mammograms. They have a great breast clinic center there. So just talk to your physician, find out your risk, find out the real information, and make your own decision.
Okay, doctor, thank you so much for this
information.
information.
Thank you so much.
It can be very cloudy sometimes.
It is. It's tough.
All right, well, anyway, guys, for a full recap on this, head over to CASA.com. We'll have it there later.